Okay guys, let me introduce myself first. My name is Harish Gupta. I am the creator of Passcoder 21 YouTube channel. I have nearly 13 years experience in medical coding in all specialties. Currently, I am working as a ambulatory surgery trainer for one of the MNC in Hyderabad. Okay. So most of the people feel interventional radiology coding is very difficult. Okay. But what I feel is interventional radiology is not that much difficult what we feel. But just we need to know the guidelines related to IVR coding. Okay. So what is IVR guys? Anyone knows what is IVR? Anyone? Yeah, good. So what is the difference between IVR and IR? So basically both are same only. So IR means interventional radiology only. IVR means interventional radiology only. So basically both are same. There is no difference between IR and IVR. Okay. So now, so who will perform IVR procedures? Any idea?
Radiologists.
Yeah, perfect. So radiologist. Okay. So especially the people who are familiar with these procedures will called as interventional radiology surgeons or interventional radiologist. Okay. And basically IVR procedures are not open procedures. Okay. Mostly these are percutaneous procedure where patient will not perform any incision. He will create small incision and he will insert catheters, guide wires, all those things through that incision. Okay. So just IVR is not open procedure. Okay. So in this session we are going to see agenda is we are going to see few basics related to IVR coding, and we will see Appendix G, which is very essential in order to understand and in order to code IVR charts. And we are going to see few scenarios related to interventional radiology. And lastly, we are going to have Q&A related to this session. Okay. So as soon as we complete this session, I will post this session in the YouTube also. Okay. So if anyone looking for APC's local chapter webinar links for free CUs, medical coding jobs in India, USA, UAE, join in our WhatsApp group. So I will provide the group link is in the description of this video. So first we will see definition of IVR. Okay. So what is IVR? Interventional radiology. So how many types of IVR we are having guys? Anyone knows? How many types of IVR we have currently? Yeah, no worries. So basically we are having two types of IVRs. Okay. So if you divide IVR, interventional radiology, correct? So here intervention means procedure or CPT surgical procedure. R means radiology. So IVR means procedure with radiology, where patient will use imaging guidance in order to perform the surgical procedure. So that's why we will call it as interventional radiology. In ICD-10 CM coding or in US medical coding, we will call it as procedure. But in Australian and UK medical coding, we will call it as interventional procedure. Or they will call it as, they will not call procedure, they will call it as intervention. Okay. So interventional radiology is a procedure where patient will use imaging guidance in order to perform this intervention. Okay. We are having two types of IVR procedures. One is non-vascular procedure and another one is vascular procedure. Okay. So most common non-vascular procedures are fine needle aspiration biopsy, core needle biopsy, and also central venous catheter insertions for catheter insertion for dialysis. Next one is drainage catheters. In urinary systems, you will find drainage catheter and digestive tube insertions and also you will see urinary tube or catheter. Okay, and also most common non-vascular IVR procedures are tumor ablations. Okay, and also incompetent vein ablation, where fish will ablate the veins or varicose veins, and also we will see arthrograms, and also we will see joint and soft tissue injections. Okay, so and also sometimes you see vertebroplasty and kyphoplasty. What is vertebroplasty, guys? Anyone knows? Okay, so basically vertebroplasty is a procedure where patient will inject cement into the fractured vertebra. Okay, during that cement injection, patient will use the imaging guidance. So that's why even vertebroplasty comes under non-vascular IVR procedure. Okay, so these are the common non-vascular IVR procedure. Now we will see vascular procedures. Okay, so what is meant by vascular, guys? Anyone, any idea? What is vascular procedure? So basically, vascular procedures are the procedures where patient will perform procedure inside the vessels, mostly blood vessels, artery and vein. So which we will call it as vascular procedure. So what are the common procedures we will encounter? Selective and non-selective catheterizations, lower extremity procedures like angioplasty and atherectomy, as well as stent insertions. Okay, and also we are having arterial thrombectomy, vein thrombectomy, and also centrally peripherally inserted catheter insertions. Okay, so these are the common procedures we will encounter during our routine day by day coding. So you got this, guys? What is the difference between non-vascular IVR and vascular IVR? Any doubt here?
No.
Clear, na? Okay, so what is urinary catheter insertion? Non-vascular IVR, vascular IVR?
Non-vascular?
Yeah, perfect. Yeah. Why means here, in order to reach or see the urinary tract, patient will use the imaging guidance. Correct? So because of
Yes.
that reason, these all procedures comes under non-vascular IVR procedure. Okay. So basically, IVR coding depends on two components. One is surgical codes, 3 series CPT code. Next one is radiological supervision and interpretation, where we will use 70,000 series CPT. Okay. Most of the time in IVR procedure, you need to use 3 series code along with 7 series code. But here there is a logic. All codes are not, all procedure does not need 7 series code. So whenever you code IVR procedure, you need to check the code descriptions. Why means few 30,000 series codes already included imaging guidance. Okay. So along with those codes, you can't use 7 series code. Okay. Next, we are having non-selective catheterization and selective catheterization, which is more basic component you need to understand before coding any type of IVR procedure. Okay. So what is non-selective catheterization? So this is very simple. Okay. The catheter or needle is placed directly into an artery or vein or is negotiated only into the aorta, thoracic or abdominal, SVC, IVC from any approach. What is SVC, guys?
Superior vena.
Yeah, superior vena cava. Okay. And next, we are having inferior vena cava. So IVC means inferior vena cava. So what happened during the non-selective catheterization? Physician directly insert catheter into the major blood vessels. From major blood vessels, he will not go anywhere. So it will comes under non-selective catheterization. Okay. So next we are having selective catheterization. So movement of the catheter into the arterial system beyond the aorta or vessel punctured. So that one we will call it as selective catheterization. During the selective catheterization, patient will cross the aorta and he will reach another small vessels or small arteries or venous system. Okay, so that is the selective. Selective means patient will select the location where he wants to perform the procedure, where he will cross the aorta. In non-selective catheterization, patient will not cross the aorta. So that is the difference between non-selective and selective catheterization. Next, we are having ipsilateral and contralateral. Okay, so ipsilateral means same side. Okay, contralateral means opposite side. So what happens? Some procedures, patient will insert the catheter on the
Side.
left side. Okay, from left side he will go to abdominal or thoracic aorta and he will go to right side. Okay, if the patient performs complete procedures on the left side, we will code it as ipsilateral. Okay, from the left side he will reach the abdominal aorta or thoracic aorta, and if he reaches the right side, you will call it as contralateral. So just this is simple. Ipsilateral means same side procedure. Okay, contralateral means opposite side. That's all. Okay, next, whenever you want to code IVR procedures, you need to understand the vascular order. Okay, in IVR procedures we are having three orders, basically four orders we will see in the image. So first order, vessel, that is primary branch of the aorta or vena cava. Okay, second order, vessel branching from a first order vessel. Third order, vessel branching from a second order vessel. Okay, so we will see the image now. So if we see this image, this color is first order. Okay, so this is the major vessel. Okay, from the first order we are having second order. So this blue color vessel is the second order. From the second order we are having third order. Okay, so like this, based on the size of the vessel we are having the orders. So if you observe this one, first order is like a larger vessel compared to second order and third order, correct? So second order is lesser than first order. Okay, third order is lesser than both first order as well as the second order. So based on this, they have divided in order to code IVR procedures: first order, second order and third order. Okay, you can see this image and tell me what is going on here. So anyone tell me what is going on here? Okay, so basically this is also a IVR procedure, but this is related to heart. Okay, so what is going on here? In order to perform IVR procedure, patient needs to inject the contrast, correct or not? So after injecting the contrast, if it leaks into the body organs, it will show you like this. See this one, as there is a hole here, contrasting is coming outside the vessel. Okay, so by this procedure, physicians will identify the problems using this contrast material. Okay, so after identifying the this abnormality in the vessels, physician will perform stenting or any other type of bypass graft in order to treat this condition. So this type of IVR is common for both whole body. Basically this is related to heart. Even lower extremity also you can find this same procedure. Initially physician will inject the contrast and he will observe the imaging guidance. Okay, if he observe any leakage like this, he will perform the appropriate therapeutic procedure. Okay, so that is the meaning of this image. Okay, any doubt guys here? So now we will see Appendix G, which is very important in order to understand IVR coding. Okay, so we are having basically two vascular families. First one is arterial vascular family. Okay, so next one is venous vascular family. Okay, so this is the venous vascular family, but most of the time we will get procedures from arterial vascular family. Okay, so arterial vascular family is more extensive than venous vascular family. Okay. So this is the thoracic aorta. So this is the main branch. Okay. So again we are having the abdominal aorta. Okay. So the diaphragm will divide this vascular family into thoracic aorta as well as abdominal aorta. Okay. So if the patient inserts catheter in the thoracic aorta, you need to code from these codes. Okay. So if the physician inserts catheter from the abdominal aorta, you need to choose these codes or these vessels. Okay.
Mm.
So any doubt in vascular family? Clear?
Yes.
So how many types of vascular families we have?
2.
What are those?
Arterial vascular and venous vascular.
Yeah, arterial vascular and venous vascular. Okay. Mostly 90% you will find in IVR coding, you will find arterial vascular. Okay. Again, this vascular family divides into 4 families
2.
or 4 orders. Okay. First order, second order, third order, beyond the third order. We don't have any separate code for beyond third order. We need to use third order code for beyond the third order also. Okay, if you check arterial vascular family, we are having 4 orders. Whereas if you check venous vascular family, we are having only 3 orders. Okay, so this is the major vessel here. Superior vena cava is the major vessel. We are having first order, second order, beyond second order. Okay, so venous vascular family, we are having only 3 orders. But arterial vascular family, we are having 4 orders. So that is the difference between our arterial as well as the venous vascular family. Okay. So if you understand this one, we will try to analyze few scenarios now. Okay. So example, the catheter passed from abdominal aorta to common iliac artery, then advanced to internal iliac, further navigated into vaginal artery. So we need to code this scenario now. So what is the starting point here?
Abdominal aorta.
So yeah, major abdominal aorta, major vessel or smaller vessel?
Major.
Yeah, major
Oh
vessel.
no.
Yeah, major vessel only.
Yes.
So our arterial family divides into 2 types, correct? Thoracic aorta
Yeah,
and
abdominal and
abdominal
thoracic.
aorta. Yeah. So abdominal aorta is major vessel. Okay. Next, we will go to abdominal aorta first. Okay. So this is thoracic aorta. We can't choose these codes here. If you want to code this procedure, we can't use this one. Okay. Directly we will go to abdominal aorta. Okay. So what is our question? Catheter passed from abdominal aorta to common iliac artery. Okay. So now we need to search where is common iliac artery. Okay. So tell me where is common iliac artery here? Can you see common iliac here? Which order is in the common iliac?
Yes.
First to second, third or beyond
First.
third order?
First.
Yeah,
First
perfect.
order.
Yeah, first order. Okay. Next, from the common iliac artery, patient advance the catheter into internal iliac. Okay. So what is internal iliac? Which order? First to second, third or beyond third?
Second.
Yeah, perfect. Second order. Okay. From the second order, patient again went to vaginal artery. So what is vaginal artery here? First to second, third or beyond third order? Where do you
Beyond third
see?
order.
Yeah, beyond third order. Correct. So here,
Yes.
whenever patient crosses multiple orders, we need to code it as highest order patient reached the reached, like catheter tip. Where is the catheter tip ended here? So here our last artery is beyond third order, or catheter tip is in the vaginal artery. Correct. So first
Hmm.
patient starts from abdominal aorta. From the abdominal aorta, he went to common iliac.
Common.
From the common iliac, he went to internal iliac. From the internal iliac, he went to vaginal artery. Okay. So here our code is 36247. Okay. Select
Where
to
is the
get
code?
So 36247. Okay. So I will show you code also. So can you see here 36247? Okay. So here our initial code is 36245. Selective catheter placement, arterial system, each first order abdominal, pelvic or lower extremity artery branch within a vascular family. Okay. 36246 initial second order abdominal, pelvic or lower extremity artery branch within a vascular family. 36247 initial third order or more selective abdominal, pelvic or lower extremity artery branch within a vascular family. So here our answer is 36247. Why 36247 is the answer here? Anyone has the idea? Check the code descriptions of 245, 246 and 247. You can understand the answer.
Beyond the third, beyond the third.
Yeah, perfect. So why means, as we have discussed during the guidelines, so whenever patient performs catheterization, we need to check in the operative report where is the end point or where is the catheter tip stopped. Okay. So in our scenario, catheter tip stopped at vaginal artery. Okay. So if we check here, vaginal artery is in beyond third order. Okay. So here we need to code 36247. It's simple, correct? So if you know the guidelines, this is very simple. Okay. So next we will see one more scenario. So the catheter passes from abdominal aorta to celiac, superior and inferior mesenteric arteries. So try to analyze and do this one. I will show the chart. Yeah, this is venous family. So where do you check first? Venous family or arterial family?
Arterial only.
Yeah, perfect. Why mean?
Abdominal aorta.
Yeah, abdominal aorta comes under arterial family. Okay, so here we are having one keyword. So directly we need to go to arterial family. Next, what are the vessels? Celiac, superior and
Celiac.
inferior mesenteric arteries.
Inferior.
Total how many arteries are there?
1, 2, 3.
Yeah, perfect. First, here you need to decide whether it is selective catheterization or non-selective catheterization. So tell me, selective or this is non-selective? How do we decide? Already we have discussed.
Selective.
Yeah, perfect. So this is
Yes.
selective catheterization. Why means if the
Yes.
patient stopped at abdominal aorta, it will comes under non-selective catheterization. Correct? But patient crashed the abdominal aorta to celiac, superior and inferior mesenteric arteries. So this is a selective catheterization. Okay. And one more thing you need to remember that you need to use this arterial vascular family image for only for selective catheterization. For non-selective catheterization, you can't use this one. Okay. For selective, you can use this one.
Okay.
Okay. So what are
Okay.
celiac, superior and inferior mesenteric arteries? Okay. So here you can't see, correct? This is common iliac. Okay. So see here.
Celiac.
Yeah. So here, first one is celiac. So we can see celiac here. Next one is superior.
First.
Okay. So this is first artery. Next we are having superior
First
and inferior mesenteric arteries. Okay. So this is the celiac, superior mesenteric artery and inferior mesenteric artery. Correct? So celiac, superior and inferior mesenteric arteries. Okay. Now the answer for this code is 36245. Yeah, first order. So now tell me 245, 246 or 247?
5.
Yeah, perfect.
Yes,
Why
3,
means?
6, 4,
Yeah,
5.
yeah,
First order.
yeah, first
We
order.
need only first order.
Yeah. These are all first order. But how many arteries patient performed the examination? Total how many
3.
arteries? 3, correct? So here simply you need to add 36245 times 3. That's all.
Okay.
Okay. So any doubt guys here?